I am a human being and I kill human beings.
Before I knew it, I'd fired 4 shots at the door. I kept on shouting for Eva to phone the police.
Tests are underway to determine if a serial killer is on the loose in Centurion, Pretoria.
The dead won't bother you. It's the living you gotta worry about.
Welcome to Profiler Africa. Once again, I am Paul Llewellyn, and tonight we are delving into the intricate world of forensic pathology with Dr. Shakeera Holland. So a great episode for you tonight. Please do start getting your questions in. We'll be exploring the critical role forensic pathology plays in criminal investigations, from determining causes of death to the providing of vital evidence in court. As always, I'm joined by Jared Labuskaghni. From 2001 to 2016, Jared led the investigative psychology section of the South African Police Service. He's now the head of L&S Threat Management, and he is, of course, our profiler. Good evening, Jared. How are you?
Hey, Paul. I'm recovering from COVID. Last week I had it, but all right, doing well, thanks.
COVID is still a thing, isn't it? Clearly. Before we get into tonight's case, into tonight's discussion, a quick reminder: please subscribe to Profiler Africa for more gripping true crime stories. The more subscribers we have, the more we're able to bring you more and more great content. And do hit the like button and that bell so that you get reminded anytime we're posting new content. Join our Patreon community at patreon.com/Profiler Africa to support the show. And access exclusive content. If you'd like to contribute to the cause, it's a great way to do that. If you send a super like, we'll give you a shout out in the next episode. It's a great way. And if you send one tonight, we'll certainly make sure that we mention your comment. And don't forget to join the live chat. Like I say, share your questions about tonight's topic or anything else, and we'll tackle them in the last portion of the show. And if any good ones come up during the course of the discussion, then I'll drop those in as well. So our guest tonight is Dr. Shakeera Holland. Hello, Dr. Holland. Now, last week, guys, I spent about 20 minutes reading Lawrence Hill's credentials, so I'm going to spare everyone the pain of that this week and ask the doctor to just explain to us what it is that we do, and then we'll jump into our chat.
Thanks so much. Good evening. So as you mentioned, I'm a forensic pathologist. So my primary job is really the medico-legal investigation of unnatural deaths. I'm also a head of Department of Forensic Medicine and Pathology at the University of the Witwatersrand.
Fantastic. Okay, Gerard, I mean, do you want to... I will always kind of hand over to the smart one in the family here. So, Jared, do you want to lead off with a question?
Yeah, I mean, my first question is obviously we've known each other for many years. I was actually trying to think when we first met. It must have been the mid 2000s, if I'm not mistaken. Through obviously the work that we were doing, me and the police, you at the Forensic Pathology Services in Johannesburg. I mean, I always like to ask people how they got into this field. I mean, I don't think a lot of little girls think one day of, ooh, I want to end up cutting bodies, unless you're planning to be a serial murderer. It's perhaps not the most frequent thing that people think of doing. And so when did you first realize that you actually wanted to do this kind of work? And when did you realize that it was actually even a work you could do?
So that's a very interesting question, because it's not a straight line answer. I think it all started off with the reason why I did medicine in the first place, and that's because of my dad. So my dad was my inspiration. He was a doctor and an activist, especially during the times of apartheid, when there was not equal opportunity for everybody to access health care services. So my dad took a lead role in that, and I saw what he did for the community. I saw what he did for his patients. And that made me want to do medicine, and actually do medicine to give back to society. Then, as it turns out, when you are at university and studying medicine, you have a very, very small exposure to forensic pathology. It's literally probably a week or two in the course of your 6 years. And it immediately fascinated me. So this whole study of forensic pathology was so interesting. That coincided with a television program called Silent Witness, which the central character was a woman pathologist called Amanda Burton. And the thing that was so interesting about her was that she was very eccentric, and she had this very unique way of thinking about things, and she would solve these cases based on her knowledge of forensic pathology. And that's again fascinated me. So from as a medical student, my interest was piqued. So it wasn't something I decided to go into. So once you've finished your degree, you have to do internship and community service. I did that, and then I did a few different things, exploring my options as to what I would like to do, specialize in one day. I was on the path to becoming a psychiatrist when my dad actually crossed paths with a colleague of his who happened to be the head of forensic pathology at WITS at that time. And I thought to myself, wow, this is something interesting. Maybe I'd like to explore it a little bit. So I decided to apply for a job and see what it was like, which I did. I got the job. Initially, for the first 6 months, because our patients are actually deceased. So for the first 6 months, it was a big adjustment because I felt like I really missed the living. But then it really started to take hold, and I think the most important thing for me is that the work we do is so important. So again, not many people can do forensic pathology, so not many doctors go into it as a speciality, because it's a very difficult thing to see the kind of violence that we see on a daily basis. So it immediately sparked my interest, and it made me feel as if this is the way I can be that difference. Because what we actually do is by our investigations and by our the outcome of what we contribute to the criminal justice process. Once we have done our post-mortem examinations, all our findings go to the police as part of the investigation. And then the full investigation, including our reports, would go to court. And we have to be able to present a report based on the evidence of what we see, the interpretation of that evidence, to stand up in court to facilitate the criminal justice process. So in a nutshell, that's how we ended up here.
Sure. I mean, and it's interesting because that people's journeys is never a straight line, and how often TV shows and movies have actually influenced people getting into certain fields. People in the States, people who perhaps are from other countries, different countries have different systems. You hear about America, they talk about the coroner and what their role is versus here in South Africa. Do you want to just quickly, for people that don't know, what is the difference between a coroner and a forensic pathologist system?
So yes, so essentially, again, you've touched on it, that each country, and in fact each province or states in different countries, have different medico-legal death investigation services. So the coroner system is one type of system. So this is where somebody is appointed to oversee the medico-legal death investigation service. Now, that person doesn't necessarily have to be a forensic pathologist or even a doctor, but usually it's somebody who does have a knowledge of forensic pathology and forensic medicine. Then in other places, you have the medical examiner system. So a lot of the places in the United States have the system. And this is where the person leading the medico-legal death investigation service is actually a qualified forensic pathologist. Now, in South Africa, we have forensic pathology services, and we are the custodians of unnatural deaths, and we facilitate this medico-legal death investigation service. So currently, we are a department within the Department of Health. So independence, so sort of like the Forensic Pathology Services is an independent body, but under the umbrella of the Department of Health.
And it's quite, as I understand, like the coroner system, they have a lot of power. I mean, literally, the cops aren't allowed to touch the body until the coroner and their team arrive. They're the ones that determine if this is a murder or a suicide, if I'm not mistaken. It's quite a bigger role than just determining cause of death. Whereas our system, it's kind of, you're focused on, what is the cause of death? The cops then have to do everything else. Is it a murder? Is it a suicide? Is it an accident? And who's responsible?
That's correct. So, with the coroner system, from what I can understand, that the coroner will decide whether or not a medico-legal death investigation is warranted in a specific case. Whereas in South Africa, we have laws that clearly identify the definition of an unnatural death in this country. Once a death is declared unnatural, a medico-legal post-mortem examination or medico-legal investigation is mandatory under the law. So once the death is unnatural, there has to be a medico-legal death investigation, and that investigation must include an autopsy. So what happens the step by step is that somebody dies, the police at the scene, based on what they see or the history, will indicate that the death is unnatural. In the law, the National Health Act, we have regulations and a code about forensic pathology services, which give us the 4 big categories of unnatural deaths. And based on that, the police will classify a death as unnatural. Once the police have done that, forensic pathology services then takes custody of the deceased individual and facilitates the whole medico-legal death investigation, with the primary focus, as you said, in uncovering the cause of death. However, we can contribute to the circumstances of death. It is not our primary focus, but based on our findings, we are able to contribute to the information about the circumstances of death.
And I mean, that you mentioned unnatural deaths, because I mean, a lot of people think that you're just doing, violent deaths, gunshots, stabbings. But I mean, the whole spectrum of unnatural deaths is very, very broad.
Right.
I mean,
That's correct.
you've got on the one hand a guy who falls off the ladder painting his house and dies. That's an unnatural death, and you will have to have an autopsy. So what are the kind of other examples that people might not think about that's going to end up you having to have to autopsy someone?
Okay, so the big categories that we have are firstly death due to force, which you've already mentioned, and I mean this is the ones that people know about. So your gunshots, your stabs, your injuries from motor vehicle crashes, and then there's some unusual deaths due to force, like animal bites, animal attacks, snake bites, scorpion bites, things like lightning, which is sort of an act of God, but in our setting is unnatural. Circumstances of death that are related to hypothermia, in other words, very, very hot conditions like heat stroke, hypothermia, like when somebody freezes, and then, of course, overdoses. Okay, so that's your first big category. Your second category is what we call procedure-related deaths. So this is where somebody has been in hospital and has undergone a surgical procedure, and that procedure has either caused the death or somehow contributed to the death. And these are the ones where people may have a natural disease, so they go into hospital for a natural disease, but because of the procedure, or because they die of the procedure, it becomes unnatural. Then the third category, which is also related to medical deaths, is when there's an element of negligence. In other words, the health professional treating the person either did something or did not do something, and that led to the death of the person. And then there's the final one, which can also be a little bit confusing, which is your sudden, unexpected deaths. So this is where somebody who has no medical history suddenly dies. That death is unnatural until proven otherwise. So those are, so again, you've mentioned before, big categories. And in fact, we know that there's approximately 70,000 unnatural deaths per year in South Africa, of which we have about 17,000 of them in Gauteng. So it's a huge, huge problem. It's a huge, massive burden of unnatural deaths that South Africa is facing.
Could I jump in there? How would that compare to other countries? Those kinds of numbers, just to put them in context.
So to be honest with you, I can't quote stats, but I mean, I've been to the UK, and I've actually been to different forensic pathology services in the UK, and I mean, they get excited by seeing less than 50 so-called unnatural deaths a year. I mean, to the extent that in countries like the UK, they don't have an independent forensic pathology speciality because there's just not enough cases to justify it. So most of their forensic cases are done by anatomical pathologists that train in forensic pathology or super specialized in forensic pathology. So in fact, in countries like European countries, they do not see many unnatural deaths. I think the comparison that would be similar to what South Africa sees are places like Brazil and some places in sub-Saharan Africa, where we do have a very high burden of unnatural disease.
So, I mean, on average, how many autopsies are you doing compared to the colleagues in, say, working in the UK?
Again, it's difficult to say, but I mean, like I said, if they do 50, it's a lot. And here in South Africa, you're looking at approximately like 400 to 500 cases per doctor per year, if not more, which is massive.
Okay.
And to give you a comparison, so the American guidelines indicate that each doctor should not be doing more than 250 cases per doctor per year. That is their standard. And obviously, it's because the practice is not just about doing an autopsy. So an autopsy is one aspect of the practice. It's about doing the autopsy, then making sure that you are writing a report to interpret all the findings. And that report must be able to stand up in court. So it's got to be an excellent report, and it must not, there shouldn't be any fault with it. So that by the time it goes to court, that there will be no issues. So, it's not just about the autopsy, it's everything else that is related to the autopsy. So our burden and what the doctors here do, massive compared to other places.
Okay. And how many, do we have enough forensic pathologists to fill the need? And do we have a good pipeline of youngsters coming through the education system?
So yeah, the issue with us is that we just do not have enough posts. So forensic pathology service is a government service. People come in, obviously people don't have a choice because of the law. Every single person who dies an unnatural death has to have a medical legal examination. So by virtue of that, we are a government service. And unfortunately, we just do not have enough doctors' posts in our service. There's a lot of interest. So when I started doing forensic pathology, it wasn't sort of one of the more popular specialities or more popular areas that doctors would go into. Now there's definitely more interest. Okay, so it's not the most popular, but there's definitely more interest based on all the emails I get every day of doctors who want to come and experience what we do. But unfortunately, our limitation is that we just do not have enough funded posts.
Okay.
I mean, how many forensic pathologists, I don't know if you've got an accurate figure, are there currently in South Africa?
Okay, so just to preface that by saying that the doctors in our service are not all specialists. So a specialist is somebody who's done medicine, then done further exams to specialize in a particular field in medicine. So when you're looking at specialists, there are only about 60 in the whole country. And obviously, to put that into perspective for people that don't know, I always like to use the example of a department of surgery in one hospital. Generally speaking, you'll have 60 specialists running sort of one hospital. Whereas with us, we've got 60 specialists for the whole of South Africa. So in addition to the specialists that we do have doctors that work in the service that are not specialists. So in other words, they've done their medical degree and they work and get trained in the service, but they are not specialists. But yes, so there's very, very few specialists in South Africa.
Okay. We're going to get into the training in a moment, but a lot of, as you said, would you almost go to say that there's probably more non-forensic pathologist doctors who are doing autopsies than there are forensic pathologists doing autopsies? Because you think about it, it's all these little tiny towns have to have, the capability of someone in the area to do these.
Yeah, that's right. Yes, that's exactly right. And what as you said, just to say that the doctors that come into our service, they get trained to do the work, but then they also have opportunities to do a diploma, which is a certification through the College of Medicine in forensic pathology.
And perhaps the next logical question is, how do you actually become a forensic pathologist? What, is it a university qualification? I mean, I know the answer, but perhaps for our viewers, because there's different pathways actually.
So the way it works is that to become a specialist forensic pathologist, you have to get a registrar post, which is a training post at a university and in a university associated medical facility. Now, those posts are allocated specifically to each university. Once you get a registrar post, the training is approximately 4 to 6 years. During that time, you have to complete exams. The way that we operate in the Wits circuit is that the registrars have to complete the College of Medicine exams, which is 2 parts, part 1 and part 2, very rigorous and extensive examinations. And then they also have to finish a research component at the university to be able to specialize. So it's a very difficult path because it's any speciality is a lot of work. Because obviously we want the type of specialists that are going to be able to render an excellent quality of service.
So basically, it's not just a case of I want to study forensic medicine. There has to be an actual government-funded registrar post for you to take up to actually do that. Is that kind of, in a way, how it's limited?
Absolutely. And then obviously the other limitation is that you have to have specialists to train the registrars. So if you don't have specialists, you can't train registrars.
Guys, I'm just going to jump in. I'd just like to say hi to everyone on the chat. Binks and Marius is with us again, and Cindy and Mandy. The folks are sending through some questions, and I'm taking note, and we'll tackle some of them as we go through the show. Not sure where Helen is tonight, Gerard. I'm a bit worried. We've got a regular visitor. Her name's Helen, and she's not with us tonight. But okay, guys. Hi, guys. We will get to your questions. Now, my next question is, you've got 2 roles at the university and work for the Department of Health. What does a typical day and a typical week look like for you?
So it's a little bit difficult for me to answer that because my days are not typical in that I do have quite a big obligation to the university because of my position. But generally speaking, if you have a person who's what we call a joint staff, so they are doing service within the Department of Health as service delivery and they have academic obligations, they would essentially be doing post-mortem examinations every day. Then they would have to be doing teaching of medical students and other students in the different forensic spheres. So in addition to medical students, we also teach forensic science students, and we also teach the other students in the allied professions, like in law students, sometimes even people that are training to be paramedics. We've also trained a lawyer, police as well. So training and teaching is a big part of what you would do if you are somebody in the joint staff. The reason why I'm saying my day is not typical is because of the fact that I'm currently the academic head of department. So then my responsibilities extend also to the management of the department at Wits.
Okay. Okay.
And you're normally based at the Diepkloof mortuary, is that right? Are you still based there?
I'm still there. Yes.
Oh, talk to us a little bit about the facilities that are available around the country. I know that, we were speaking about this a bit last week, that there's a new lab that's being built in the Midrand area that seems to have been taken a bit. But tell us a little bit about the facilities that are available around the nation.
Oh, yes. So here's the thing. Prior to 2006, forensic pathology services fell under the police. And with all the buildings and the logistics and operations being run by the police, and then doctors from the Department of Health working within that service. But to make the service more equitable, especially considering our past and our issues that we had with apartheid and all the atrocities there, a more equitable thing was to transfer the services to Department of Health. And actually, ultimately, what we need is our own completely independent service. But anyway, so the old buildings that were already there then just became a different department, but the same buildings. So unfortunately, there are a lot of buildings that haven't had an upgrade. Now, I don't know too much about it, but I do know that Cape Town has gotten a beautiful medical legal facility. I believe Gerard was there last year. And Johannesburg Forensic Pathology Service should have already been moved to this fantastic flagship mortuary, which was being built or is currently being built. So there's been a lot of delays. I think originally they were supposed to move in 2019, and then there were a lot of delays, and they're still currently busy with the transition or the building or something along the lines. But essentially, unfortunately, our facilities, I think most of the facilities in the country definitely need an upgrade. And unfortunately, again, the problem is money. And the fact is that facilities across the board in Department of Health, hospitals for living patients, are all struggling with this lack of resources. So it's a problem throughout the Department of Health, and we are subjected to those same issues.
Okay. Gerard?
Yeah, thanks. I mean, so obviously we've discussed how many there are, how do you become one? What has kind of been for you the sort of most memorable part of your journey? I mean, I always like to ask people, are there interesting moments that stick in your mind, unexpected things that have happened to you as a result of the work or during the work? And of course, if there are any interesting cases that you've worked on that you'd like to just refer to or mention, we're always happy to listen.
Yeah.
So I mean, I was just thinking back, as I've done this job, it's I started in 2003, so it's a very, very long time, but it doesn't feel like such a long time. It actually feels like it's gone so quickly. I think it's because I'm always engaged. There's always new things. There's always things that challenge you. I think it's the one speciality where you never feel like you know enough. You're always learning. And I think of the cases that stand out, I mean, this is such a sad and horrible case, but it was one of the very, very early cases I did when I just started. And it was a 10-year-old child that had gone missing. Eventually proven, the child was eventually found to have been kidnapped. And there was a massive manhunt for this child, and eventually they managed to track down the kidnapper. So when the police went in to arrest the kidnapper, he then jumped off the balcony. I think he was on the second or third floor. He was staying in this flat. He jumped off the balcony and he died. And when they went in, they called us in. And what we discovered was that the child's body had been put into a suitcase, folded up and put into a suitcase. And this man was essentially living with this child's deceased body in the suitcase. We then, when I went in and I opened the suitcase and I removed the child and I examined her, it looked like she'd been dead for quite a number of days, based on the level of decomposition. So he had actually been living in this flat with this decomposing deceased child for at least 3 to 5 days. And obviously the whole issue was he'd kidnapped her for the ransom. But I think that based on what we found, she had died very soon, after the kidnapping. So, I mean, that was one of the saddest and most vivid things that I've ever had to do, was extract this child. She was covered in layers of plastic, and her face was completely occluded by sellotape and sort of duct tape that was wound around her face. So that is something that was disturbing, and that image, I don't think I'll ever forget it. So I see sad cases like that all the time. I think for me, the cases that affect me the most are the kids and the women and the partners of gender-based violence. Those are the ones that stick with you because they're so violent.
Just on that, I mean, if we were to break down the large amount of unnatural deaths that we have in a year, kind of, what are some of the maybe percentages of that look like, when it comes to, say, murder, car vehicle accidents, etc.?
So the majority of the cases are actually transport related. So I would say about 55% are transport related. So all injuries related to transport deaths. So that could be car accidents, motorbike crashes, train accidents, and those types of things. And then I'd say we see approximately, so it depends on obviously where you go, but I think we see approximately 10 to 15% would be gunshot related. Another 10 to 15% would be things like sharp force injuries like stabs. And then we have the others. So things that we don't see a lot of are like poisonings. And in fact, we do not see in the greater scheme of things. So we do not see the high percentage of sort of gender-based violence. We don't. We do see them, and again, they are particularly violent, but it's not the majority of what we see.
Okay, fair enough. I'm just going to drop in a question here, which I think is fairly pertinent. I'll see if I can bring it up on the screen here. Let me just put it in the right spot. Okay, there. Okay, so from Pierre, what backlog do we have in SA? So what does the backlog look like, Doctor?
Depends what you mean by backlog. So,
bodies to autopsy, I guess, or
bodies to autopsy. So essentially, that's a difficult one to answer because again, it's based on each facility, what they're seeing in the week. So if I can give you what we see in Gauteng generally, so we do. Each doctor in the service does 4 autopsies per day. A facility like Meticulous Forensic Pathology Services sees approximately 3,000 cases a year. A facility like Johannesburg, which is very big, sees about 4,000 cases a year. So it would really depend on the day, the amount of doctors we have present, and the amount of cases that we take into the facility. But so again, difficult to answer that. So generally speaking, we do not like to leave massive backlogs. Try and make sure that that from the time a case is admitted to facility until the time of the autopsy, we don't want it to exceed more than 2 to 3 days. Is that always possible? No, it's not, especially when there's a period where there's a lot of public holidays, and during that time, there's a lot of intakes. So it's not a question that I can answer absolutely. But again, I don't think any facility is going to have massive amounts of cases awaiting autopsy. Now, when you talk about backlog, I mean, there are different aspects of the job. So, for example, toxicology, in other words, the investigation of checking substances in the blood when there's things like overdoses. Now, that is a problem. It's always been a problem in this country, and there is a backlog of toxicology results. And then reports, post-mortem reports. There is a backlog of post-mortem reports because, again, with the statistics that I've given you. So we have this massive amount of post-mortem examinations, small amount of doctors doing them. So they have a massive administration burden. So there is sometimes a delay in the post-mortem reports. Now, we're obviously working on that and, always try and get on top of things. But again, it's about lack of resources and shortage of posts. So difficult question to answer because so many aspects.
Sure.
But it's not a case of a body's going to sit there under normal circumstances in South Africa. The body's not going to sit there for 3 weeks and it hasn't been autopsied. They'll usually be autopsied within a day, usually the next day, unless it's the very big, like if it comes in on a Friday, all those bodies over the weekend will be autopsied typically on the Monday. So that might, a body could be
usually so no, I don't for a deceased individual to be at a facility for a prolonged period of time is unusual. That shouldn't happen. Again, I'm not privy to what goes on in the smaller areas, but generally speaking, the whole point is that we cannot have the bodies sitting for long periods of time without an autopsy, because then you're compromising the evidence and defeating the whole purpose of doing the autopsy. So generally speaking, I don't think that would be the norm.
Okay. Guys,
the report could.
Okay.
The report could take a little while to come out, especially, as you say, if you're waiting for toxicology results. Which I just want to point out to everybody: the tox doesn't go to the police. That's not the police's fault. That goes to the Department of Health, and you're waiting for those results, and that might be crucial for you to make your final diagnosis.
It's a good point you make. So Forensic Pathology Services does not do toxicology. So our toxicology at the moment goes to NHLS, the National Health Laboratory Service. They are doing the toxicology. It used to be the National Department of Health had a toxicology service, but now it's changed. I think it was about 2 years ago, which it changed to the NHLS. And the reason why it's so important is that the toxicology that is used for medico-legal cases, it's not just sort of like running a drug screen. You've got to run a specific screen. It's got to be run in a specific way in an accredited laboratory with accredited instrumentation. It's got to be run with 2 different tests to verify the results. And ultimately, again, it's because those results must stand up in court. So it's not a simple thing of, we're going to a lab and running a blood test. And unfortunately, there is a big backlog. So it's not Forensic Pathology Services and it's not the police.
Okay. Guys, if you are just tuning into the podcast, we are speaking with Dr. Shakeera Holland. We're talking about anything and everything that you'd like to know about forensic pathology. So if you'd like to get your questions in, please do just send us your questions. I'm stacking up some from the live chat that we'll be dropping in. Please do subscribe to the channel. It really does help. You can support the show on Patreon also. Simply search for Profiler Africa there. We always welcome super likes and like I say, get in your questions and we'll tackle those in the last 10 minutes. This episode of Profiler Africa is brought to you by plotshift.co.za, your trusted partner for TV and commercial content production. Whether it's compelling storytelling or high-quality visuals, Plotshift is the team to make it happen. Visit us today. Okay, and we are back. Okay, guys, I would like to ask a question now. I would like to know about how the two of you have crossed paths professionally in the past. Cases that have you worked on cases together? How did you guys meet? When did you guys meet? Give us a little bit of the lowdown on your background working together.
So I remember.
Sure,
Jared, do you remember?
Yeah, go for it. No, I don't remember. You
no. So you don't remember. I remember exactly because I must tell you that Gerard is he's phenomenal at what he does. And how I met him is that he wrote to my professor, head of department at the time, to ask if we can participate in the training for the police, the investigative psychology unit training that you run every year. And of course, my prof knew I was like into all things weird and serial murders. In fact, I did my my MMed research serial murder.
Okay.
So obviously, okay. So anyway, so I met Gerard, and that's how we met, and it was fascinating because he's just phenomenal. And in fact I lectured, and then he invited me to stay for his lectures, which I did, and it was great. So then I think we did it every year after that for quite a number of years. So it was great, and we've never worked on a case together. Gee.
Okay.
I don't think so. No. It's just been this sort of. What I was going to say is it's interesting the personalities at the different mortuaries. We were based in Pretoria, where head office was, but we would never go to the Pretoria Forensic Pathology Service if we needed training or assistance or advice. We would go all the way to Johannesburg because the Johannesburg Forensic Pathology Services just really had a bunch of very open, interesting, willing to help kind of people. So that's why we would, come all the way to check that side. And if we had new people working in our unit and we wanted to get them some autopsy exposure, we would then bring them through all the way to Johannesburg for them to sort of have, get that autopsy experience. But yeah, I don't think we've ever had a case that we've worked on together. I don't think.
No. But I must also say that we were very, very fortunate to have Professor Labuschagne as part of our honorary staff at Wits University. So he is a member
Yes.
of the department, and he lectures our forensic science students in investigative psychology, and he also supervises masters and honors and PhD students.
Okay.
So I'm fortunate because he's brilliant, and we're lucky that we've got this academic relationship.
How well regarded are the students that come out of the program? I mean, how do they do internationally as well?
Look, I don't know. I mean, to be honest with you, I don't know internationally.
Okay.
The again is that we produce these fantastic students, and there are not a lot of jobs because obviously forensic science is a very much majority of it is in the public domain, right? So you would have to work in a university or a lot of the time in the police, and there's just not enough posts really. I mean, I think again the police have the same situation as we do in health, where they just do not have enough posts for what they need. But we do have quite a few students that work in the police. In fact, I ran into one of our students today who works in the victim identification unit of SAPS, and it's lovely always to see them. They do very well. We have some of our students that are working sort of for international bodies like the ICRC, International Committee of the Red Cross, and they do very well. So generally, I think our forensic science degrees are excellent, and I just don't know exactly where all of our students are at the moment.
Okay. Gerard?
Yeah, and I mean, like you said, in South Africa, forensic pathology is kind of, as you said, limited mostly to working for the government. You do get a few people who do private forensic pathology work. That's not the norm, it seems to be. And that's often sort of, I guess, the older crowd that, I guess, got tired of government service. I don't know.
I don't know either, because I'm full time.
May I jump into the actual process of an autopsy? And just to kind of enlighten the viewers a little bit about exactly kind of what the steps are in an autopsy, what are the kind of critical things that you have to do. Just talk us through from kind of arrival in the morning and then just through a single autopsy. What does the process look like?
Okay, so I must tell you that our job starts even before the autopsy. We are often called to scenes of death. The police will call the forensic pathologist or the forensic medical practitioner to a scene of death. And often it's to look at post-mortem interval to determine how long somebody has been dead. And this is important because it establishes a timeline. So when you're looking for, the circumstances of events that led to the death, you want a timeline to see, when was the person last seen alive, who was with the person, because all of that is going to help you establish exactly what happened to that person. So going to the scene is part of what we do. When it comes to the actual post-mortem examination, we start off with an external examination where we document everything to do with the identity of the deceased, the clothing, and then all the wounds or trauma on the outside of the body. We then do investigations like an X-ray, sometimes is necessary. The next thing in the autopsy process is that we open up every single part of the body to examine the internal organs. Again, we examine the organs looking for unnatural pathology like injuries, as well as natural pathology. So in other words, diseases that could have led to the death or contributed to the death of someone. We also then do any special investigations which are warranted. So, for example, if a overdose is suspected, we would do toxicology testing, which means we take blood for toxicology. Sometimes we need to take something called histology. So this is where we take tiny samples of tissue. Those tissues are processed to go into slides, and we look at the tissues under the microscope. Again, this is to help us with diagnosing the cause of death. And then once we've done the complete examination, all the investigations, the organs that so if we have to take investigations, again, histology is a very small portion of tissue, but everything else that we have now examined goes back into the body. The body is then stitched closed, And once the doctor is happy that everything has been done, they will sign the forms, death notification form, and then the body is released back to the families.
We actually have a question here. I'll just bring it up. What happens to the deceased body if there is no one to claim it after an autopsy from Switch Chicken?
So we do have a lot of cases where people come in for because they've died unnatural deaths, but they are what we call unidentified. So in other words, we do not know the identity of the deceased. Now, in Johannesburg, that is a problem because we do get a lot of migrant workers. So people that come from elsewhere, whether it be other countries in Africa or even countries from different provinces, come to Johannesburg, and then they come in sometimes where the identity is not known. Now, what then happens is that as forensic pathology services, we take reasonable steps to identify the body. This would include things like fingerprints, for example. We have fingerprint database, and you'll actually be surprised to learn that there are people that are not on the fingerprint database. So South Africans that maybe do not have, official identification papers, and their fingerprints have never been in the system. Because again, we do have people coming from so-called rural areas into Johannesburg. So if we still cannot identify the deceased after reasonable steps have been taken and after a certain period of time, the deceased then gets buried as a pauper, which means a pauper obviously means poor, and the state will then pay for a burial with a proviso that we know exactly where the deceased is buried. And we take the relevant DNA samples so that if family members come forward after some time looking for the deceased loved ones, we're able to check whether the person that they think is deceased is actually related to them, and then we're able to say to them, okay, this is where the deceased has been buried, and they can then retrieve the body.
Okay. Gerard,
question.
Yeah. I was going to jump in with another question. Sorry, but Gerard, you go. I'll jump in with a question after you from one of our viewers. Sorry.
I mean, just state, perhaps it is an obvious question, but like, let's say you do your autopsy and it actually turns out the person died of a heart attack. What's the procedure? What's the process then?
So again, ultimately, after the autopsy has been performed, the forensic medical practitioner signs what is called a death notification form. And this would indicate, firstly, if the death is natural or unnatural, and then the cause of death is put on that form. That form then goes to, and then you get the official death certificate. So in the case of where somebody, the example that you're using at the moment of a what turns out to be a heart attack, often those people come in as a sudden, unexpected death, and that means that they sort of drop dead for no reason. And then once we discover a heart attack, it's a natural cause of death, and then they would be signed out as natural. So that is not a death that is going to be either going to inquest court or prosecution court. That would be natural, signed out as natural, and then the family or the loved ones can take the deceased and bury, or do whatever funeral or burial rites that they feel.
Okay.
But even after, even after an autopsy that was a definite unnatural death. Well, I mean, once the autopsy is done, the body can be released to the family. You don't need to hang on to the body once you've done the cutting autopsy.
Exactly. So, so as I mentioned, once the forensic medical practitioner is happy that they've taken all the necessary investigations, the body can be released. So once the identification of the person has been established, and once the forensic pathologist is satisfied that all the relevant investigations are done, that body can be released to the family or the loved ones.
Where is all of this information stored? How is it kept? How do we hang on to all of the information that we gather in the process of the work that we do?
So believe it or not, forensic pathology services in Gauteng still doesn't have an electronic database system. So everything that we do is paper-based. So we have
okay.
Yes, massive rooms of case files.
Wow.
with reports. So it's not ideal. It's not ideal at all. Again, but it does point to that we just have not had the kind of resources that we should have.
So let's talk about that a little bit. I mean, what are some of the challenges? Because obviously, we all live in South Africa, and we all kind of some mornings wake up and turn on the taps and the taps don't come on, and we've all gone through the load shedding experience, etc., which is essentially just a lack of sustaining and maintaining good facilities at the very top level, and poor management. I mean, clearly from what you're saying, I mean, you have those kinds of challenges. What are kind of some of the key challenges, and what would be some of the things, not to make it a negative conversation, what would be some of the positive things that you would like to see happen to address some of the challenges in your field?
Okay, so first and foremost, we need more people. So we need more doctors, we need more forensic pathology officers. So these are the people that actually assist with the postmortems and with the transportation of the bodies and the running of the actual facilities, right? So more posts. Our facilities need an upgrade. We need facilities where we have proper storage, we have bigger storage, we have proper state-of-the-art equipment for autopsies. We would love to have the facility to have an in-house toxicology laboratory, again, which would mean that we'd need sort of experts to be part of our service. So chemical pathologists to be part of our service, as well as the equipment to run it, because I think we'd be able to do a lot more if we were able to do our own toxicology testing with the appropriate accredited laboratories. I think we definitely need a computerized or digital database system. I think it would make things so much easier, much more accessible. I think it would be much easier for the doctors to then do the reports correctly and make sure that the reports are stored, as you said, in a secure and safe way. So yeah, I mean, there's a lot of areas that we really need an upgrade. But I think for us, working on the ground, I think what would make the biggest difference is actually to get more people. Okay. Because I mean, the numbers, it's astronomical. And if we are able to get more people, we're able to definitely improve the quality of the service. Right? That's the first step.
Okay.
And then again, the other big area for me is this digital database system, because in fact it's very difficult to know the extent of unnatural deaths in this country because we don't have an accurate reflection of what's going on.
Yeah. No, I'm sure the viewers will be surprised but not surprised to hear that everything is paper-based still. Yeah, it's just, again, I think that's relevant to so many things. Okay, let's see. We have an interesting question that came here from Cindy R., one that I was going to ask as well. How do you manage your mental health and not become depressed when dealing with difficult cases? How do you, it's a lot, isn't it? So how do you manage that aspect?
So I'm just laughing because I lecture medical students, right? And I almost know there's going to be one student is going to ask me about my mental health. It happens every single time I do a lecture. And to be honest with you, I don't think there's an easy answer. I think it's very difficult to say that there's a standard way of dealing with it. I think people deal with it in different ways. Me particularly, Gerard, I don't know if this is healthy, but I know I got into this field particularly because I wanted to make a difference in this way. I know what it entails. I then keep work at work. So I try not to go home with cases. And in a lot of ways I do in fact sort of compartmentalize my life, so my work life is my work life, my home life is my home life. Does it mean that there are cases that don't affect me? No, they do. I mean you can't not be affected by what we see. But it's just my way of thinking of things. So I have like little boxes in my head and I put my work boxes aside when I'm at home. I don't know if that makes sense. Gerard, tell me, is that a healthy? Okay,
no,
don't tell me.
That sounds very good if you can do that. Yeah.
But actually, to be fair, I do have a very good support system. So I have, my husband, who's also a medical doctor. I'm able to talk to him. I had my dad, who was a phenomenal medical doctor, and I was able to talk to him. So, sometimes when you need to sort of debrief, you have your colleagues. I also have very good, close friends who are also my colleagues, and we are able to chat to each other about things, that bother us, whether it be work or emotionally. And again, I mean, look, I haven't had to go for therapy yet. Let me say yet.
Okay.
Hopefully. But that's how, and what I say is that, you go into it with your eyes wide open. So, I wouldn't have chosen this field blind. And obviously, you get into it. If it's not for you, you don't stay in it. Do you know what I mean? Very, very soon after you start, you'll know, is this something you can do or not?
Yeah, absolutely. I know Gerard seems to handle it by gardening. Every few weeks I go to his house and there's a new mound of rose bushes in his garden. I don't know why he's always digging in the garden, Gerard.
I've chopped all the other ones down out of frustration.
Are you sure, Gerard? You're not burying bodies in the back garden, Gerard.
No, actually, I was going to say that. So, like, when I studied at UCT, and there was this cardiology professor who had the most beautiful prize-winning roses, and then it turned out, well, I don't know if all of this is urban legend, but basically there's a disease where you have too much iron in your body, and the treatment is that you get almost like they remove blood. Okay, so they bleed the people because they have too much iron. So apparently he used to use that blood for his roses, and it was fantastic.
Okay.
Need to try.
Okay. Guys, do not
try that.
Well, do not try that at home. I was going to say to the viewers, please, guys, do not try that at home. Okay. I was interested as well, just kind of high-profile cases you might have worked on, and any of and what might be different about a high-profile case where there's a lot of media interest, etc. in a case. How do those play out?
So let me tell you something. This high-profile business is a pet peeve of mine. Okay, I don't believe in high-profile.
Okay.
For me, my patients, and I'm going to call them my patients, although they're deceased, are treated exactly the same, regardless of who they are. So they get an equitable service, an excellent service, regardless of who they are. So I don't believe in high profile.
No, sure. I guess what I really mean is, when there's more attention on a particular case, then, there are different pressures that might come in from different places. Maybe the department is a bit more involved, or there are, politicians want to kind of have their say. Have you ever come across anything like that? Or?
Definitely. So yes, I've had to deal with a lot of political pressure. There's always that, but essentially the key thing about our job is that we have to be completely unbiased. So our reflections, our interpretations, the way we handle a case, we cannot be we have to do everything the same for everybody. So I mean, I have had situations where there have been pressures or political pressures, and all I do is just make sure that I do the same quality of autopsy for every single case. So I mean, I can't really answer that really. I mean, because for me, case is case.
No, I think that's a perfectly great answer. I'm going to bring up a question from Pia again, just because I think it's always good to know if anyone's got any particular tricks on this one, and that is, how do you deal with the smell of decomposition?
That is a very that's a very good question. And in fact, I was busy with some cases today, and I came home. So we wear a full protective, what we call PPE, personal protective equipment, obviously because we're dealing with hazards like blood, body fluids, and all sorts of things. And today I had 4 cases that were very decomposed, and that smell of decomposition seeps. I think it even goes into your skin. So I mean, the first thing I do when I get home, strip, shower, wash the clothes. Really, that's the only thing.
Absolutely, but no tips and tricks on anything to any smells to counter or anything like that. Nothing works, is it?
So yes, what I always say, right? The first thing that's going to happen to you when you start this job is the smell. And I'll tell you a personal story, but like when I started in the winter, in the winter, it was July. Now in winter we get a lot of burns cases, so this is it's common because obviously people with no access to electricity, they use fires, and our burns tend to be fully charred, so the bodies are completely charred. And you know, when I started, I mean, to me it smelled like braai. I mean,
Oh,
like
okay.
it was terrible, and I actually couldn't eat meat for about 6 months because I just, you know. But the thing is, you know, the sad thing is, either you get used to it or you don't. So you'll know on day one, can I deal with it or not? So unfortunately, if it's something that really troubles you to the extent where you become so, you know, you have a very visceral negative reaction to the of a deceased individual, as well as the decomposition, as well as the burns, then you'll know, and then, you know, you'd rather don't do it.
Okay.
There's no,
When do students actually get
you know,
exposed to?
you
Sorry.
know that thing of the, what do they put there, the camphor,
Vicks.
whatever, under the nose,
Okay.
Vicks. I don't think it works. Hey, gee, did you ever try it? I don't think I've
It's
never
just to
tried
get
it.
a
I don't
horrible,
think
sickly, sweet smell. And as I say, Vicks opens up your. The intention of Vicks is to open up
Well,
your
exactly.
sinus, so you're just getting more of that into your sinuses, and it just is a horrible, sick smell. So just you know, suck it up or leave.
Yeah.
that's
Okay, well, we've come to the we've done an hour, guys. So, Jared, I don't know if you have any more questions you'd like to jump in with. We've covered most of the questions from our viewers as well that have come through on the live chat. Jared, what do you think as far as just some questions to wrap up the conversation?
I wrote one down here. Are there any sort of misconceptions or misperceptions that drive you up the wall that you'd like to correct for our listeners and viewers?
Yes. I think first and foremost, for some reason, there's a lot of distrust or mistrust in the service, and people have this perception that we our opinions are swayed by the police or swayed by politics, and in fact that is not the case. So in a government service, especially, so I mean, obviously I'm talking specifically about, you know, the service in which I work, which is in Gauteng. The way in which we do post-mortem examinations are standard. We interpret the findings based on scientific knowledge, and whatever we find is completely unbiased and based on what we see. So I think that's the thing that people sometimes do not understand. The other thing is that everything that forensic pathology services does is completely free. You never have to pay. So as a member of the public, there's nothing that you have to pay for in our service. So from the time the deceased individual is admitted to our facilities, all the investigations, the post-mortem examination, everything, it's part of this. Nobody has to pay for it. I mean, I've heard horror stories of people being told that, oh, if you pay this amount of money, it will mean that your case will go faster, and things like that. So I think those are the two areas that I find very, very difficult. In that, you know, people need to know that what we do is standardized. We're not influenced by anybody or anything, and you never have to pay for anything that we do in a government service.
Okay. Where do you see your field going in the next 10 to 20 years? What are the kind of major technologies that we're seeing in the world that are kind of impacting your profession? So, you know, what do you see your trade looking like in the next 10 to 20 years?
I mean, there's a huge. Okay, firstly, the electronic resources. I mean, you must have heard something called a autopsy. So autopsies are basically the radiological investigation, which is a combination between an MRI and a CT scan. And, you know, that is the kind of technology that is happening overseas. It just allows for remarkable resolution of cases. So we have what we call a low doc scan or X-ray scan, but the autopsy is a different level of scanning. So that's something that you know is happening everywhere, and it would be amazing. There's also a lot of genetics and gene identification, like genetics when it comes to identification, because, you know, we're delving deeper and deeper into this understanding the human genome, and I think that's going to play a big part in forensic pathology. The other area is obviously AI. I don't know, you know, at the moment AI for me could be a very valuable tool for us to help us with doing reports, and sort of also help us with our research. So you know that we are associated with Wits University, and research is something that we're really, really keen on doing, because with the research we're going to, I think it's going to sort of open doors as to, you know, what avenues we are going to be able to pursue and what things we're going to be able to solve. So maybe AI is something that can even help with broadening our research, firstly our topics, and our capacity for research, you know. So maybe for me those are the big three things.
Okay.
Just-
Yeah.
do- do-
First,
do you-
first thing though is to just move beyond the lever arch file.
Okay.
Okay.
And do you think that the future is going to be that you don't cut into a body anymore? That you'll have that fancy, high quality scan?
We always have this little bit of a debate, because you know the limitation of these autopsies is actually evidence collection. So
Okay.
and also we've done sort of like comparisons to say, in an autopsy, what can you see in an autopsy that you can't see in a autopsy, right? And there's certain things that are difficult to see. So like you know, collections of blood, if there's a foreign body, and then evidence retrieval. So I mean, I think where vertigo become very important is for these sudden unexpected deaths. Because a lot of the time, you know, in the sudden unexpected deaths, there are a large majority that are natural. So you wouldn't need to do an autopsy if you had excellent imaging. So if you examined the outside of the body, you had excellent imaging, you know, you may not necessarily have to do a full autopsy for those types of cases. So I think, you know, it can extend to what it can replace the autopsy in unnatural deaths, particularly.
Okay, guys, I'm going to jump in with one last question from our viewers. And then I think we can think about just some final comments. Hey, guys. So we've got from Cindy, is there a process for a family to challenge a finding?
I think it would depend very much on each case. So I don't think there's a general answer about that. But what happens? So what happens? Maybe if I can just explain what happens in South Africa.
Please.
Every single unnatural death that comes into our facilities gets investigated by the police. So when the post-mortem examination has been completed, and I've told you that you need to compile a report, the report then goes to the police. And then it actually forms part of the investigation, right? And then that case will go to a court, either an inquest court or a prosecution's court. Now, during that process, the findings or report is scrutinized by the Director of Public Prosecutions, right? So I think that, and up to this point, nobody else has access to that report under the law. Nobody's allowed to have access to the report except the police or the Director of Public Prosecutions. So once it's been scrutinized at a number of levels, will it only then go forward? Now, I'm not too sure. Maybe I don't know a circumstance where somebody would want to challenge a finding. I'm not too sure. But essentially, I mean, the findings are based on what is seen during the autopsy. So I'm not sure, you know, under like.
Yeah, look, I think it might also be, I guess, depending on what Cindy's referring to, because obviously you guys are doing cause of death. So a guy can be found hanging from the ceiling in his bedroom. The cause of death is hanging. Okay.
That's it.
You're not saying it's a suicide or an accidental hanging or a murder even. It's the police investigation which would get hopefully in a direction of one of those three options. You know, did he accidentally slip and fall and got his neck tied, caught up in a cable, or no, we found a suicide note, or no, we've spoken to his therapist and he had depressed suicidal ideas. So that information gathered by the police on top of the autopsy cause of death by hanging is what would get presented to the inquest magistrate if they did feel it was a suicidal death. So I guess you could say the question challenging the cause of death, I suppose you can get a second autopsy done if you want to. Challenging whether it's deemed to be a suicide, well, that, as I said, is going to be something that the magistrates, the inquest court magistrate is going to be having to look at. Or I guess you could ask to present some alternative views, I guess, I don't know. Okay. Or you could give those views to the police and they will either incorporate that into the investigation.
Okay. All right, guys. Well, I mean, what a very riveting discussion. I mean, I'm sure we could carry on talking all night, and hopefully, Doctor, we'd like you to. Sorry.
No, I'm just saying, Gerard and I can talk about our jobs forevermore. Hey, Gerard.
No, exactly. That's why we have profilers, so that Gerard can once a week get all of the masses of information that's in his brain out a little bit, so that it doesn't explode with too much good knowledge. Doctor, we'd just like to invite you. To be a friend of the show and of the channel. I mean, we'd love to have the opportunity to invite you back in the future. Perhaps possibly when cases go from not resolved to resolved, for example, some interesting cases. So we'd love to invite you back. Thank you so much. We have a comment here. I have some from E. Else. I have so much respect for you and the job that you do so well. The dedication and ethics that you convey is inspiring. Thank you so much for all you do. I think that's a great sentiment that I'm going to kind of wrap up my part of the conversation on. Gerard, your final thoughts, questions, comments?
Yeah, no, thanks so much for sharing, what you do, how it goes, answering the questions. Thank you.
Yeah. Doctor, I mean, just your final thought. I mean, if you could list the three things that you would like to see happen kind of most urgently to really kind of help, the forensic pathology effort in the country be the best that it could be, what would those two or three things be? Just to sum up.
So definitely more posts.
Yep.
More posts, better facilities, and then I think independence of the service, because an independent service means that we can actually map our path, our very unique path, particularly to our needs.
Absolutely. I hope conversations like this will encourage some folks to consider going into the field, some young people that might be watching the show. So yeah, guys, you've heard it. There is a need. And if you're looking for certainly a very interesting career path to go into, if you've got what it takes, if you've got the backbone for it, then and the nasal passages for it, then yeah, please, guys. Hopefully this conversation will help with that. That's it then, everyone, for tonight's episode of Profiler Africa. Thank you for joining us. Thank you, Gerard. Thank you, Doctor. Please do make sure to like and subscribe and share the show with your mates. And come back next week, of course. Thanks to everyone who has subscribed and continues to support the podcast. We'll be back again next week. A special thanks to Amy, Bax, and Fred for their continued support behind the scenes. And of course, Gerard, I think the last thing I wanted to ask you is just to remind us what's coming up on next week's show.
Yeah, so continuing with this kind of a theme, we're going to have Dr. Estelle van Staden, who actually works, is a colleague of myself and Shakeera, but she works at the Braamfontein Mortuary in Johannesburg, one of the busiest mortuaries in the country. So she's also a forensic pathologist, but she works 2 mornings a week for cutting bodies at the forensic mortuary. But the rest of the week she spends doing forensic pathology services, forensic pathology kind of work. And she's going to be discussing how that's quite different to the stuff that Shakeera has been talking about. Of course, Estelle, many of you might know, she is the sort of host of the TV show Autopsy, which I think is on CakeNet, very popular show that also talks about cases, a lot of them she's worked on. And also she is an author of the book Blood as a Voice, which came out, I think, about a year and a half ago, which has been very popular insights as what it's like to be specifically a lady doing this work in South Africa. So she will be on the show next week. So it's a slightly different angle about what she does, etc. So that's Estelle van Staden.
Fantastic, guys. So thank you, Gerard. Thank you, Dr. Shakeera Holland. Good luck with your work, and we hope that everything that you do just kind of improves and goes from strength to strength. Thank you, everyone, for watching. Thank you for everyone who joined the live chat. We will be back next week with more Profiler Africa. Thanks so much for tuning in, guys. Don't forget to keep looking over your shoulders, folks.
I am a human being and I kill human beings.
Before I knew it, I'd fired 4 shots at the door. I kept on shouting for Eva to phone the police.
Tests are underway to determine if a serial killer is on the loose in Centurion, Pretoria.
The dead won't bother you. It's the living you got to worry about.